Let's just say you turn someone down and they think, if I'm not going to get it with Dr. Rachel, I'm going to go elsewhere. So heading overseas, maybe to maybe just nearby countries, JB, Thailand, anywhere, all to get those procedures, number one, and maybe at a cheaper price as well. What do you say to that?
I would say just between us.
Welcome to the very first episode of Just Between Us, where we are going to have like a casual chat between women. I'm your co-host, Juliana Yeow.
And I'm your other co-host, Nat Koh.
And today is going to be very exciting because we are not alone. We have a special guest in the studio with us. I would like to introduce Dr. Rachel Ho. She is an aesthetic doctor with a focus on skincare as well as minimally invasive treatments. Hi, Dr. Rachel.
Hi, Jules. Hi, Nat.
Hello. Thank you for joining us today. We have so many questions. Too many questions.
So many. So I'm wondering if I could start things off, get the ball rolling. I think I follow you on social media.
Thank you.
And I absolutely love your content because you make it very relatable. You make it very easy to understand. And we have to talk about the social media trends that are going around. I think one of the things that I've noticed and that you've brought up as well is that younger people are getting aesthetic treatments right now.
That's right.
What do you think about this? Or is there a threshold or like a hard stop if like say a young patient comes into your clinic and requests for treatment?
Okay, that's a couple of questions and I will answer it. First and foremost, yes, I agree. There is a trend of younger patients coming forward to look for treatments or even prejuvenation where they're looking at preventive strategies to delay signs of aging. And I think the media portrayal and changing standards or perceptions of beauty are influencing this trend. As to whether there is a minimum age or hard stop to getting these treatments, it isn't so clear-cut, but where the US FDA is concerned, it does not recommend people below the age of 18 to get these treatments for cosmetic reasons. And I also do feel, let's just say, if you're very young, like say with a teenager, and your facial features are still developing, your bones are still growing, your soft tissues are changing, this raises the question of whether, as a practitioner, should you then be offering a patient treatments in this stage where things are just changing to whether temporarily or permanently change their facial features.
So can I just get this straight? Like by law, there is no rule that
There's
you
no
cannot
rule.
administer any of these treatments.
Yes.
It's a highly recommended.
It's a bit of a gray area, and I think that's because Botox, for example, is used for medical reasons, not just cosmetic treatments. That's why it's very hard to draw, say, a distinction, and that's why these are recommendations that come in from these regulatory boards.
It must be quite hard to make the decision on whether or not to do some of these treatments, especially if, let's say, like a parent brings their child.
Oh.
Okay, this is like your 16-year-old birthday present.
Isn't that a culture in South Korea?
It
like
is.
when you reach 16 or 18, then you get like your own ang pao for you to do your procedure, right? Like it's a cultural thing in South Korea. A Korean friend of mine actually received that.
Oh.
Yeah, but she didn't go for any of the procedures.
Has there been a situation in your clinic that you had to say sorry, no?
So first of all, I don't see this trend happening in Singapore at this time where people get like a graduation budget to overhaul their features. But I do see parents bringing in their usually a teenage patients to come in to get certain conditions treated. For example, acne and acne scarring.
Okay. But with acne scarring, right, like I do know that it stays with a person for a really long period of time. But I guess for certain people it fades off naturally, or it doesn't seem so serious after a period of time. So Dr. Rachel, do you think it's something that you would recommend getting fixed at that point of time, or wait it out, give it a couple of years? Yeah.
Well, I think the answer to this has to be very individualized. But let's backtrack a little bit. The two main types of acne scarring that people commonly speak about, and first of all, are the dark marks, which are a bit more flat. We call it post-inflammatory hyperpigmentation, very common among Asians, and they tend to fade off sometimes in months, sometimes in years. Really depends on the patient. So for patients like that who have this kind of discoloration and they're okay with it, then they have the option of, say, waiting it out or trying topical skincare before opting for in-clinic treatments. And then there are another type of scarring, which is what we consider the true scarring. You get the depressed scars or the raised scars called the hypertrophic scars. These scars usually don't improve on their own, and they're going to need in-clinic treatments to get them resolved. For a number of my patients, they struggle, I guess, psychologically and with their confidence when they have these scars and dark marks, and that's why they opt to get treatments.
And on that note, since we're talking about scarring, I have a scar that I actually got from a rope burn. I was gekyang, I tried to do the whole Spartan challenge thing, and then there was a rope burn down my shin. And is it true that like the longer you leave a scar, or like the older the scar is, the harder it is to remove? Like should I have gone in with like maybe laser treatments, or like try and target that problem as soon as the scar forms?
As soon as the scar forms, you can actually have certain treatments that improve the scarring outcomes. And so to answer your question, yes, that is partially true.
But it's not fixable now that it has been like a good 5 years that I've got it, right?
Yes, most scars can be treated even if they're a couple of years old, decades old. Really depends on the type of scarring that you have.
Right. Oh, that's so interesting because actually a couple of years ago I had like a 3rd-degree burn from long story short, I can go and do something lah. It wasn't a whole procedure in case we're concerned. No, but I had that really bad burn, and I think someone told me to just add bio oil onto it, and it actually worked. So like now when I look at that area, like it's actually just this area, my chest area, I don't really see the scar. In fact, I don't really see that discoloration at all.
I mean, you saying that, I've never noticed that you had a scar in the area. So can we debunk that? Like bio oil, does that work?
Bio oil, I think, became really popular after Kim Kardashian was using it for, I can't remember what, but it really brought bio oil into the spotlight as some form of cosmetic treatment. But I think the evidence for bio oil in lightening scars still is very patchy. But as a oil with emollient properties, because it moisturizes the scars, it can help with the recovery rather than truly lightening the scars itself.
So it helps with the healing process.
That's right, And once you have less inflammation with a shorter recovery process, outcomes tend to be more positive.
And on that note, since you mentioned it was, I had no idea it was, did you say Kim Kardashian?
Yeah, if I recall correctly.
That made
I
this
had no
product
idea either.
popular. I think there are so many different products that come to light and like have gained mainstream popularity because of social media, because of celebrity use. I'm somebody who gets tan very easily. So I always like joke and say, if I cross the road to walk to the bus stop, I'll get like one shade tanner. If I
Do you wear sunscreen? Do you carry the
do
umbrella?
Religiously wear
Very
sunscreen,
good.
but I don't carry an umbrella. I don't like the fuss to like hold something else. I'm usually holding coffee, so like
Hands are full.
Yes, my hands are full. I got my bag, got my phone. So when I know that I'm going to be outside for a longer period of time, I will sunscreen, and then I also take oral sunblock. But I don't know how much of it is like psychological. I feel like it works, but I don't know whether is it psychological. Like, what's the science behind oral sunblock?
So oral sunscreens typically contain ingredients like fern extracts, and I think the most popular one is something called polypodium leucotomus. It's a very long name. But anyway, they've been found to reduce your risk of sunburns in people who've got prolonged exposure to the sun, but they don't actually function as a true sunscreen. Sunscreens, when you apply, they sort of absorb the UV rays and then convert it to heat. But the oral sunscreens don't function this way. They what they do is they absorb the UV rays, or they sort of reduce the oxidative damage after your skin absorbs the UV rays. So to be clear, they are not truly sunscreens in its definition, but they do have some sun protective benefits.
So by me layering, is that like the right thing to do? Because I still need the topical, is what you're saying then.
Yes, to answer your question, you definitely need the sunscreen. I think that's the first line recommendation across all guidelines around the world. And these oral sunscreens act as a supplement if you feel that your topical sunscreen use is insufficient.
There are quite a number of questions that I feel are surrounding this. So I've also heard that like even though your SPF is SPF.
Yeah, SPF.
SPF.
I was like, I got confused for a moment. SPF is very high. Like a lot of brands would go in and say like, ours is like 100 something, right? That might not necessarily be like a good number, because you are not going to be able to fully use the benefits of that high number. Is that true?
To a certain extent, yes, because the amount of sunscreen protection that you get from your sunscreen is also dependent on how much you use. Because to get this SPF number, for your product, these products are being tested in a lab on volunteers with a fixed amount and to determine this SPF number. So if you're not applying the same amount, which is, to be specific, 2 milligrams per centimeter square of body surface area. And that works out about 2 to 3 finger lengths of sunscreens for the face alone. And it's quite a significant amount. Most people don't actually use this amount. And so the actual realized SPF that you're getting from your sunscreen is very likely to be lesser than what's written on the label.
I see.
And so having this higher SPF, I guess, allows for some avenue of compensation if you're not using enough sunscreen.
Oh, sunscreen.
It's a science. It truly is a science. I don't know, but apply your sunscreen to
Yeah, really
our dear
important.
listeners. So coming into this episode, right, Nat and I were super excited, and we did a little bit of research. We were, watching a little bit of content, and then Nat shared with me that she has a friend who's very enthusiastic about DIY treatments.
Yes. Okay. So if you look at my eyes as well, I did not get anything done, but just to so when I don't sleep enough, this double eyelid disappears. So what I used to do when I was younger, just put double eyelid tape lah.
Yeah.
So a friend of mine, took it to the next level. He actually cut his own double eyelids at home. Yeah, and I don't know. I thought that was kind of freaky, but the recovery, I guess, was okay. You can really see the results. He had very hooded eyelids, but now you can actually see there's that taper eyelid kind of look. And on top of that, I think with all there's many other trends going on. Many people are sharing their experiences about their own homemade DIY situation when it comes to doing procedures like maybe micro needling even. And what's that one about the face
chemical
burning?
peel, they're doing vampire facials at home.
Yeah, so Dr. Rachel, what do you say about what do you have to say when it comes to these kind of procedures at home? Personally, I think number one, not really safe. The sanitary is another thing, but I want to hear from you.
Yes, I completely agree with you. I think safety is a big issue here. It's not just about the sanitary conditions. Is this are your tools being disinfected? Are they sterile? Because obviously you don't want complications arising from infections and contamination. But also, to me, it's really scary if for someone without understanding of anatomy and physiology and going in to do invasive procedures, you might end up with scarring or even, compromising the vasculature and ending up with necrosis, for example. I guess some of the extreme things I've also seen on TikTok are people using things like freshly squeezed lemon as a form of chemical peels to lighten their dark spots. And there is some science in it, like citric acid, yes, it's acidic, but it doesn't, it's so uncontrolled compared to a very controlled procedure in the clinic where we know the concentrations of, say, the chemicals going in. We know it comes from a legitimate, source, as opposed to something so arbitrary. What's the pH of it? You don't even know, and that's how you can end up with complications.
Right.
So I think, as a practitioner, I would not advise for anyone to get these procedures done at home by yourself, by someone else. Especially by someone who's not qualified and, you're not really sure where your source of your products are coming in from.
But what about the quote unquote safer procedures like maybe IPL? Because IPL machines right now it's I see so many ads you just get that machine and it's for a fraction of the price of how much you would have to pay for if you go and actually get it professionally done. What about something like that?
So I guess what you're talking about are devices which try to replicate in-clinic technologies versus something where it's truly DIY, someone creating lemon juice or their form of micro-needling. So I guess with these products, these legitimate products, they're a lot safer. As to whether they are effective, I think it is very device-specific because we see, say, with very common tool is LED light, for example. This is something that we also use in the clinic to treat conditions like inflammation or acne. But we see the data coming in mostly from devices that have met certain safety standards or, done trials where the evidence is validated as compared to these devices from that are much smaller with completely different parameters that try to spin off these results, you see. So it's, I mean, in summary, I think it's hard to say whether these devices at home that have not been validated by trials, whether they really work, but I also don't think they're harmful.
Right.
Nat, I know why you asked that question.
Why?
Because Nat wants to buy something, is it?
I think she's already using one of these like home remedies. I wouldn't call it like a DIY. It's not as scary as like lemon juice or and to be honest, when you mentioned that earlier, I can see how people are like jumping on this because it seems so harmless.
Yeah, it's convenient, it's easy, you do it yourself, right?
Yeah, and like how bad can a lemon get? But in Nat's case, I know you have a habit of doing gua sha,
Yes.
which I think is amazing.
Yeah, wow, it's a commitment, I tell you. I try to do it maybe 3 times a week.
You are very
maybe
committed.
alternately. Really?
Yeah.
Thank you.
So where do you learn this from? Or like
Wow.
you've seen effects?
Yeah, so back again with like the trends. Saw it on TikTok, saved so many videos, watch a couple of them, and then like try to understand like, oh, okay, like when you do a certain thing, it's to get rid of like, I don't know, the fine lines on the forehead, it's to give you the jawline, different things. So I just tried it out. Do I see effects? So I don't know whether it's placebo. But so one thing I realized I tend to scrunch up my neck a lot when I sleep, okay? And super uncomfortable when I wake up in the middle of the night. But I realized when I gua sha, I don't do that. So I just like really sleep like Sleeping Beauty, you know?
Wow,
Yeah.
impressive.
But when I don't, I'm like, so is it placebo? Does gua sha actually work?
I think the evidence for gua sha is still very sketchy. However, there is some data that shows that certain gua sha tools or techniques can reduce muscle strain, muscle tension, and that helps to reduce, I guess, the pull on the skin, and that's how it improves fine lines. At the same time, I guess when you keep rolling on it, you may help to improve the lymphatic drainage. You might feel that it's less swollen. So, you know, I guess what you feel, you know, it's the legitimate outcome from gua sha. But as to whether these are something that are sustainable long term, I don't think we can be very certain at this point.
But if it makes you feel better.
It makes you feel better.
Yeah.
Yeah, sometimes I tell myself, it's okay, I feel
As
better.
long as you're not like
already.
hurting yourself or like causing any harm to yourself, I think that's something that you can continue pursuing. So now I want to like jump behind the scenes a little bit.
Yep.
Since we have you in the studio, we have so many questions, like so many myths to debunk and stuff like that. But you run your own clinic.
That's right.
And I'm very curious to know, with social media trends, we also have country aesthetics and country trends,
Yep,
right?
you're right.
What are some of the more popular procedures that Singaporeans tend to get?
I think what I get a lot is pigmentation treatment. I guess in our part of the world, having pigmentation or clear skin is a priority for many people. So I have a lot of patients coming in to get, say, their sunspots or solar lentigines or melasma or post-inflammatory hyperpigmentation treated. And we do that with things like lasers as well as chemical peels. Yeah, so that's one of the top things. I think second that's really popular is the concept of collagen banking. And it's a trend that's taking off in many parts of the world where people are, like I mentioned earlier, taking a preventive step towards aging, you know, trying to improve their skin quality, skin texture, increase the banking of fibers that make up the structure of the skin to delay signs of aging. So what's really popular in my clinic are energy-based devices like HIFU or high-intensity focused ultrasound, which triggers the skin to build collagen. And secondly, the category of injectable moisturizers where we replenish hyaluronic acid in the skin that's naturally present in the skin, which also diminishes with age. And this process also seems to trigger collagen and elastin synthesis in the skin to give rise to more lifted, plumper, and softer, younger-looking skin.
That's super cool. Injectable moisturizers, you say?
That's right.
So is it the one where like you go into your face and then you put like a lot of injections?
Yeah, so we inject hyaluronic acid into the skin, but there are also categories of these products where it's about 4 to 5 points versus 150 points that I think is really popular in social media.
Right. And then for HIFU, what does that process look like? Because I hear HIFU a lot. Like people always talk to me about like there are some names like Rejuran that comes up, and then also HIFU. It's just like, oh, I just did a HIFU facial. Yeah, what does that look like, or what exactly is
So
it?
HIFU stands for HIFU, high intensity focused ultrasound, where we use a device to transmit very strong, very focused ultrasound shots to the skin at specific depths, typically 3 millimeters, 4.5 millimeters, to target the deep dermis as well as something called the SMES layer, because we want the collagen building effects to be targeted at this layer to lift saggy parts of the skin. And in some parts of the face, we can also remodel the face to some extent by causing controlled fat loss. So it's very useful for people with double chin or a bit of sagging in the jowls. Yeah, so that's HIFU. Rejuran actually is an injectable treatment, very popular in Korea. Again, I think it's becoming popular in the US because of Kim Kardashian's very recent salmon sperm facial. It was very widely talked about. Rejuran is made up of DNA fragments derived from the sperm of salmon fish, and of course it's purified. It is said to also repair skin damage from, say, aging, sun exposure, acne, and things like that.
It's all Kim K.
It's
Yeah.
all Kim K. It's all the trends, really, really.
Yeah.
Yeah. All right, but also with like you get so many things done, right? What's the keep up like? How often do you
Cannot
have
be
to-
do one time and then like magically you're like beautiful for the rest of your life.
Yeah, is it like every 6 months? Does it differ from like what you get done to what you get done?
Yes, you're right, because every treatment has a sort of fixed lifespan, and also how long it can last in the patient is very much dependent on things like their metabolism of certain products or their lifestyle. So, for example, if you are a smoker, we can expect certain treatments to dissipate faster than someone who, say, has who doesn't smoke. So that there isn't a straight up answer, but generically speaking, collagen building treatments we're looking at about 6 to 12 months apart. Again, treatment specific, or say treating wrinkles typically 4 to 5 months apart when the results wear off.
But when it comes to this as well, right? Because all of us do want to look young, we want to look youthful. But what is the recommended age for someone to maybe start considering these procedures? Because I think it's very different when someone who's 16 years old
That's right.
compared to somebody who's maybe 36, 46.
So I think the concept of taking care of your skin is something that you should start early. So of course, in your teens, I would not recommend getting cosmetic treatments like, Botox and fillers. But I think you can have a skincare routine that can help you age-proof your skin. We're talking about things like sunscreens, for example. I don't have a straight-up answer to you, because I think that at different stages of life, and it's obviously so varied for everyone. Your skin and how you age differs. But broadly speaking, that we can expect at different, say, stages of your life, certain things to appear. So what's common in the 20s is like adult onset female acne. 30s to 40s, we start to see early signs of aging, sagging, wrinkles, and dark spots. And the 50s, 60s, and beyond, this becomes more pronounced. And in every stage, I think there will be a different recommendation.
So, Dr. Rachel, if I want to go to you
Yep.
to get something done,
Yep.
what would a consult with you kind of like look like?
We begin the consult in my practice with me asking you really, what do you want to achieve? What are your personal goals? And
Right.
if you have any boundaries or barriers, I think it's good to let your doctor know too. So I will hear from the patient, why are they here, what do they want to see treated? And then I will let them know, let's say meeting you for the first time, like anyone else, what do they see in you? What maybe there are signs of aging or certain, features in you that may influence people's perception of you. So for example, if you tend to frown a lot, it tends to make a person look less approachable. And then I would point that out to a patient, because I think these can be very apparent in the first few minutes of the encounter. So we have a discussion, hear from the patient. I share my take on things. And then we talk about, say, certain treatment recommendations. And if the patient is ready for it, then we then move to when shall we then begin treatments? What's the plan like for them?
So is it actually possible to get those procedures done on the same day as your consult, or is it usually scheduled like a week or two after?
So in my practice, we put aside adequate time for the patient to embark on their procedures straight after the consultation. But of course, there are patients who need time to think about it, to digest it, and then they hit back and they call us when they feel ready. But yes, it is possible, if time allows.
And I'm also very curious to know. So, like a lot of people who are maybe running their own business, it's like, why would you turn down a customer?
Yeah,
right?
it's money, right?
Yeah, but in your line, I think there is always that gray area, like we briefly discussed earlier. Has there been any situation where you had to turn down any sort of treatments?
Oh, definitely. And I think it's important that we highlight that, even in an aesthetic industry, we shouldn't capitalize or commoditize patients and I guess their insecurities. So yes, I've had to turn patients down if I feel that I cannot meet their expectations, or I feel that their expectations of treatment or what they would like to achieve is not in line with what I think is good for them.
So I can imagine now with editing apps
Yes.
or like AI,
Yeah.
they would take their tweaked version of themselves and then say like, hey, Dr. Rachel, I want to look like this. Can you help me like with injectables or like the minimally invasive treatments?
Right.
And
That's
and
exactly
sometimes
what I would do. I want to look like this.
And sometimes it's just not possible.
It's
right?
not, yeah, it's not possible, you see, because either that person really requires a lot of work, or I feel that there's some underlying psyche behind it, in wanting to look a certain way.
Right. And let's just say you turn someone down and they think, if I'm not going to get it with Dr. Rachel, I'm going to go elsewhere. So heading overseas, maybe to maybe just nearby countries, JB, Thailand, anywhere, all to get those procedures, number one, and maybe at a cheaper price as well. What do you say to that?
I would say, first of all, we see this trend in Singapore. I'm noticing it. A lot of my patients, and hearing from my peers in other clinics, a lot of patients are heading to nearby countries as well as to Korea to get treatments done. Many reasons. First of all, I guess it's the appeal of a holiday and getting treatment. Number two, prices are much cheaper in a lot of the practices overseas, and it's not something that, we can control. So I think we have to respect that trend and the choices made by patients. I guess the takeaway from this is please do your research, make sure it's a legit clinic, not something fly by night. I'm sure there are many apps or, online reviews that you can check it out. And, like I tell my patients, if you want to go overseas, please take a picture of whatever injectable you're getting done or the device, ask for permission so that we can continue care as needed when you come back to Singapore.
And has there been any sort of situations? I mean, I hope not, but like maybe somebody has gotten work done overseas and it either didn't turn out that well, and then they come back to Singapore and then they're like, Dr. Rachel, please help me. That kind of situation. Are these typically covered by like insurance? What will you do in that case?
Currently, most insurance policies do not cover cosmetic work. So unfortunately, the patient has to pay out of pocket for these treatments. Yeah.
Right.
As to what can we do, I think again it's also very problem specific. I had a patient where she had fillers done in another country, and for some reason there wasn't a follow-up done, and she came back to Singapore and wasn't very pleased with the outcome. And to remove the filler was quite a process. We needed her to find out exactly what brand and what type of filler was done before we could even move to remove it for her.
Just having this chat with Dr. Rachel, I feel like I'm so calm. Like, I feel like we started off with a little bit of chaotic energy, but like the way how she explains things is just like so clear and so calm. And I totally can imagine like to be in that nice environment and then to understand really what
You guys did a good job of calming my nerves.
Oh, really?
Yes.
We have so many other questions that we would have loved to ask, but right now I think why don't we do a little shout out for your clinic? If somebody wanted to go and get like treatments from you, where should they go to?
I work at La Clinic in Paragon Medical Center, and I guess if you need more information, you can head to my blog or socials. I talk about skincare trends, skincare reviews, and really just what I do at work. Thank you very much for having me on the show.
Thank you for joining us today. Oh, a gajillion questions more.
Yeah, I'm sure we're gonna like kidnap her and ask all of our questions, but we're gonna wrap up this episode for today. It has been Juliana and Nat with you on Just Between Us. So this is our very first episode. Do like and subscribe, and of course, let us know if there are any other topics you'll want us to discuss in the future. Bye bye.
See you at the next one.